This paper, with the very captivating title, asks the question whether there is a difference between cholecystectomies done at night versus cholecystectomies done during the daytime. We know today that as far as acute cholecystitis is concerned, the standard of care recommends cholecystectomy during the same hospitalization, usually after a 24 to 48-hour period of cooling off. Some centers, however, carry this a step further and perform cholecystectomy as an urgent procedure if necessary at night times. What we don't know is whether nighttime cholecystectomy is comparable in terms of safety and efficacy. In this study, the authors have looked at a population that consisted of all patients in their center who had undergone laparoscopic cholecystectomy for acute cholecystitis, and they then divided the population as nighttime cholecystectomy if the surgery was done between 7 p.m. and 7 a.m., and daytime cholecystectomy if it was done between 7 a.m. and 7 p.m. When they looked at their data, they found that they had approximately 233 patients who were done at night and 907 patients who were done during the daytime. The comparisons were quite straightforward. The indicator variable was nighttime cholecystectomy, and this was compared against daytime cholecystectomy. And when they looked at measures of outcome, they looked primarily at complications, which was about 5% in the nighttime variety and was about 7% in the daytime variety, and this difference was not statistically significant. However, when looking at the rate of conversion to open cholecystectomies, the nighttime rate was around 11% and compared with 6% as the daytime rate, and this was statistically significant. Looking further at other parameters, they also noticed that the time to surgery was significantly shorter for those who had surgery at nighttime, and this is not surprising. And when it looked in terms of operating time, the opposite was true. That is, the daytime cases had a significantly shorter operative period than the nighttime cases. Length of stay was not different whether it was done at night or day. The authors are therefore concluding that nighttime cholecystectomy is associated with an increased open conversion rate without any decrease in length of stay or complications, and they are therefore suggesting rather dangerously that laparoscopic cholecystectomy for acute cholecystitis should be delayed until normal working hours. When you look at the study in terms of its design, several problems arise. First of all, it's a retrospective analysis. The numbers are not matched because it was not a randomized or a prospective trial. The nighttime group was significantly smaller than the daytime group, and obviously, there are going to be a variety of differences in terms of the reasoning as to why it was done at night. A retrospective trial, there was no randomization, no protocols were used, and the groups were not, strictly speaking, comparable, with ASA 4 grades being more done during the daytime. Obviously, the anesthetist didn't want to do them in the night if they could avoid it. So this was not a comparable group, and on all these counts, this study is really not a very good one. Moreover, they are inverting cause and effect in here. They are attributing nighttime as a cause, when in reality it's really not a cause. It probably accounts for a subgroup of patients who are operated at night for some specific reasons. And I think that the whole study collapses on that ground, and it's not a very good trial.